I'm Joseph Alpert, editor-in-chief of the American Journal of Medicine, and I'm here, as every month, to bring your attention to what I thought was a particularly interesting article. This one came from China, from Tianjin, China, from a medical school there, where they had been following a large cohort of individuals with a whole variety of different lifestyles and drugs, and do they end up in the hospital, and do they live and die, and what complications do they have? And they particularly were interested, of course, in cardiovascular risk factors. In other words, did the people with high blood pressure and high cholesterol and so forth and smoking have a higher incidence of myocardial infarction and so forth, just like the Framingham and a number of other studies have shown in the US. But they got interested in some reports that possibly by reducing your coronary or your atherosclerotic risk factors, you might also reduce your cancer risk. So, in fact, they went into their database and they looked and found, yes, indeed, that those individuals who had low coronary or atherosclerotic risk factors also had a lower risk for a variety of different cancers. And those people who didn't have the good risk factor profile had a higher risk for cancer. Now you might say, well, of course, smoking causes more than atherosclerosis. It causes lung cancer and bladder cancer and so forth. But still, it was interesting that the benefit of reducing your risk factors for atherosclerosis also results in a benefit in terms of decreasing your cancer risk. And so I thought that was an interesting article and just further information that supports the idea of a healthy lifestyle. Thanks for being with us today. We hope that you'll read that article and all the others in the current journal issue, and look forward to talking with you again next month.